Good morning, everyone. My name is Ann Williams-Isom, and I'm the Deputy Mayor for Health and Human Services. And we are here this morning to show how we are investing in healthcare, the healthcare workforce, and how that investment begins to realize the Mayor's vision of building a stronger, more sustainable, and more equitable healthcare system. We have asked so much of our hospitals and healthcare systems over the past few years. You all know it well. A once-in-a-100-year pandemic with which we are still dealing, monkeypox in recent months, and a range of other issues. But today, we are here to talk about something affirmative, something that begins to realize the Mayor's moonshot to transform healthcare in New York City and show America how we are taking strategic and sustained steps to invest in lifestyle medicine to truly change the trajectory of people's health, the health of the community, and the health of our budget. And let's be clear, it's not often that you see this kind of broad partnership with buy-in from all of the hospitals and healthcare systems across the city. This is a beautiful sight behind me. Collectively, these systems serve millions of patients each year with inpatient and outpatient services, and they are the trusted entities in neighborhoods all across the city in all 5 boroughs. They represent the safety net hospitals like the Brooklyn Hospital Center, Bronx Care, SBH, Richmond University Medical Center, and other research facilities like Rockefeller University Hospital, and large systems like New York Presbyterian, NYU Langone, Northwell, Mount Sinai, and specialty centers such as the Hospital for Special Surgery and Memorial Sloan Kettering. These are some of the world's finest medical institutions. The partnership today includes 20 hospitals and healthcare systems, including our public hospital system and all the other facilities and systems from around the city. You see here on these boards, you name it, they are joining us in this effort. I'll let the Mayor get into the details of the announcement, but first let me recognize a few folks. We have executives and senior medical officials from across the city with us. Dr. Kate Collins is here from the American College of Lifestyle Medicine. We have Ken Rask here from the Greater New York Hospital Association. Thank you for being here. Oh, you're behind there. There you are. I see you. And supporting lifestyle medicine for the city. And we have a few members from the administration here, including Dr. Mitch Katz, President and CEO of Health and Hospitals, our very own Dr. Michelle McCracken, Executive Director of Nutrition and Lifestyle Medicine at Health and Hospitals, and other administrative officials. With that, I'd now like to turn it over to Mayor Adams. Mayor Adams?
Yes, thank you, Deputy Mayor. And just a special thank you to both Rachel and Nate, both on my team. This has been a long journey for us, and as the Deputy Mayor mentioned, Dr. McMacken, who I met probably in the darkest medical moment of my life, who gave life to so many others with lifestyle medicine, an initiative that we started when I was Brooklyn Borough President. And so many of the faces that are here, these have been, they have been partners in conversations as we come together with one mission, and that is to create an environment when we can turn health care away from just sick care. The goal is not to wait until someone is sick and then to treat their symptoms, but to give them options of preventive medicines, and lifestyle medicine is a way to do so. And so we know the power of lifestyle medicine in our city, and I know it all too well. Many of you know my journey. I talked about it on the campaign trail, and as the borough president with my type 2 diabetes diagnosis, and millions of others who are walking around with diabetes is not aware of it. And there's no one that's here that cannot state that someone in their personal life is not experiencing some form of chronic disease. It is something that is a common denominator with us all. And we know the impact of what happens when you are experiencing a chronic disease. And our goal is to ensure that we do everything possible not to receive what I receive, of telling me I will be on a lifetime of medicine, including insulin, and 8 other drugs that I was going to have. I'm proud to say that I am not on insulin, and I'm not on any of the other drugs that I was told that was my only pathway. The unwillingness to believe that medicating myself was the only way to solve a problem compelled me to go outside our city to get answers. And I was lucky to find doctors, and so many doctors across the country, that they have already started the journey of something called lifestyle medicine. It's new to the terminology that everyday patients hear, but you better believe it, they are going to know about it now, because we're going to make sure with our amazing partners behind us from amazing medical institutions, we're coming together as a team to ensure that we give the counseling that I receive outside the city. Now we're going to have it here in the city. The advice I received almost 5-6 years ago changed my life, and it introduced me to a predominantly plant-based diet and helped me reverse my diabetes, restore my eyesight, and it allowed me to have a clear vision towards healthcare in this city. People often talk about my primary focus being public safety, but trust me, health is just as important, because in order to live in a safe city, you must live in a safe city. And that's the goal that we are accomplishing. So as mayor, I'm working with every agency across our city to make this vision a reality. We are changing how we think about healthcare, bringing healthier food and lifestyle medicine to communities across the 5 boroughs. And we're already making huge progress in this initiative. In our hospital, plant-based meals are now the default for patient lunches and dinners. Don't let anyone kid you when they tell you that these chronic diseases are part of your DNA. It's not. It's part of your dinner. It's what you eat every day that is causing many of the chronic diseases we are experiencing. Parents now in H&H can ensure, Andrew Kirschman told his cameraman, get that sound bite. The H&H right now have default plant-based lunches and dinners. Patients can choose to opt into a meal that includes meat if they want to, but the default is plant-based. Now, here's the great part about it that Dr. McMacken knew and pushed us towards. We found that over half of eligible patients are sticking with the plant-based diet, and 95% of patients who have chosen plant-based diets are satisfied. Give people a choice, they are making the right choices. Now, when we combine these choices with doctors and nurses and nutritionists, sharing with the patients how this is part of their healing process and what they can do outside the hospital, and as we expand to teach how to cook healthier meals and make smarter options, you're going to see an entire ecosystem of taking those painful moments of experiencing a chronic disease turn into a meaningful moment as you turn your life into purpose, as we instruct people what to do when they leave the hospital to improve their healing process. We're expanding our plant-based lifestyle medicine program. I will push to create the program. We created the program at Bellevue Hospital as borough president, the oldest hospital in America, and now under this administration, we expanded to every borough in the city via our health and hospital. Dr. Katz has been an amazing partner. We talked about this while I was borough president. I'm pleased to have him here in charge of H&H because he sees the vision as well. We're leading the nation with this initiative. We're helping patients make a healthy lifestyle choice, including a plant-based diet, physical activity, improved sleep habits, and stress reduction. But there's more to do, and every New Yorker can benefit from lifestyle medicine. That's why I met with executives, many of them you see behind me, from all over New York City hospitals outside of the H&H system earlier this year, and I wanted their help. And they stood up to the cause, and I cannot thank them enough. These major institutions, medical institutions, responded, and they responded overwhelmingly. And they came together with us. And so today, in partnership with hospitals all across the city, the American College of Lifestyle Medicine is making a $44 million investment to assist us in taking the next steps, giving every New York City healthcare professional the opportunity to receive lifestyle medicine training at New York City's favorite word, free, no cost. Every single doctor, every nurse, every clinical medical professional will now have the chance to receive fundamental training in lifestyle medicine, whether they work for public or private institutions. This program will have a special focus on nutrition so that every patient has the chance to change their life by changing their lunch, just like I did. We are fundamentally changing the way millions of New Yorkers receive medical care, setting the standard for the rest of the nation. Demonstrating the power of public-private partnership is what you're seeing today with 20 hospitals and healthcare systems that are all part of this initiative, systems serving millions of patients each year. This change is long overdue. For too long, we have spent billions of healthcare dollars treating the symptoms of lifestyle-related chronic diseases like heart disease, type 2 diabetes, high blood pressure, stroke risk, and so many more. And for too long, we have been writing prescriptions and ignoring the principles of healthy eating and exercise. Today, we're sending a clear message. New York City will not continue to feed the healthcare crisis. We are fighting for a better solution for our health, for our families, particularly those who traditionally are dealing with these healthcare crises. So I want to thank our partners that are here today, and specifically, I want to thank American College of Lifestyle Medicine for your investment in the health of New York City. And I think what we do here is going to cascade throughout the entire country. Together, we're going to create a New York City where the Eric Adams of tomorrow won't walk into their medical office and told that the only path they have is incident blindness, limb amputation, or a lifestyle of being on some form of drug. Not in the middle of a medical crisis should you learn your options. We want you to learn them beforehand. We're going to change the lives of people and New Yorkers and build a better nutritional outcome on how we carry out real lifestyle medicine. I want to thank everyone that's here for your partnership, for your commitment in accomplishing this task. Job well done. Deputy Mayor.
Thank you. Yeah, you can clap for that. This is a big deal. I keep on saying we're doing a lot. I hope people don't miss it. It's a big deal when we're talking about saving people's lives and giving people options. Thank you, Mayor. As the mayor said, we are setting the standard with Health and Hospital with our program first at Bellevue and now coming to each borough at other H&H locations. Thank you, Dr. Katz. And many of these systems represented here today or are standing up dedicated programs focusing on lifestyle medicine, including Montefiore Hospital for Special Surgery, Mount Sinai, Northwell, Downstate, SBH, NYU Langone, and others. There's also a lot of energy among all of our 20 partners here to bring this initiative to their teams. I want to now have Dr. Kate Collins from the American College of Lifestyle Medicine come to talk to us a few more and give us some details about this partnership. Dr. Collins?
Thank you, Mayor Adams and Deputy Mayor. It's truly an honor to represent the American College of Lifestyle Medicine by being here today as we embark on this historic project to expand the clinical skills of healthcare professionals across New York City. I am Dr. Kate Collins, the president of ACLM, American College of Lifestyle Medicine, for the past 2 years and have been a practicing cardiologist for nearly 3 decades. I have witnessed the continued rise of chronic disease despite enormous advancements in pharmaceuticals, procedures, and genetic research. This led me to the understanding that we must work to solve for the lifestyle root causes of disease to help the most individuals at a personal level and to help our cities nationwide. I have also been keenly aware of the lack of nutrition and lifestyle medicine education in my early professional training. Although nearly all chronic disease clinical guidelines suggest therapeutic lifestyle counseling as a necessary first step for all patients, We simply do not provide healthcare providers with enough detailed guidance on what that truly means, nor provide them with the skills and programs to really engage and support patients to improve their health. The American College of Lifestyle Medicine was founded to provide evidence-based clinical education for physicians and healthcare professionals. It is our reason for being. For nearly 20 years, we have been a leading provider of medical education and training, including supporting certification in the field of lifestyle medicine. And this past year, we created a new online course to introduce lifestyle medicine and food as medicine. And today, we're glad to offer 5.5 CME CE hours to 200,000 healthcare professionals in New York City. We believe that given the leadership of Mayor Adams as a local champion, the support of the Public Health Network, and with all the executives joining us today, this investment can strengthen the health and well-being of New Yorkers and hopefully inspire other cities and communities to follow suit. So over the weeks ahead, we will launch the historic training program in partnership with the leadership support of over 20 major health systems and hospitals across the city, many who are here with us today. And these healthcare executives, like many within our professional organization, understand that the costs of diet-related chronic disease are at an unacceptable personal and monetary burden on our communities. We understand that there are also social determinants of health at play, and we know that a highly trained, knowledgeable, and supportive workforce can help patients gain access to local programs and resources, and to help patients begin their journey to better health. Over the past few years, we have been inspired by the lifestyle medicine programs already underway within health and hospitals, led by my colleague, Dr. McMacken, and are pleased to see other programs rolling out across the country. In fact, ACLM is currently working with over 80 health systems nationwide, whose leaders are also integrating lifestyle medicine education and clinical programs into their communities. We encourage all healthcare personnel in New York City to join and take part in the lifestyle medicine and food as medicine essentials training. Complimentary registration will be initially offered through each of the health systems. We're working on that. But we're also in discussion with other physician groups, nursing associations, and health care institutions to bring into their communities as well. Details on the essentials curriculum can also be found through the press release or found on our website, lifestylemedicine.org. So I understand that we may also hear today from other health system leaders on their support for the training program and the potential impact it may have. On behalf of the entire community of ACLM, again, I want to thank Mayor Adams and all of the New York healthcare organizations who are joining us to launch this vital new program. Thank you.
Thank you.
I know it's tricky. Be careful, be careful. Yes, next, thank you so much, Dr. Collins. I'd like to now have Lorraine Brown, President and CEO of One Brooklyn Health System, come and say a few words. I've been a fan of yours for a long time, so I'm very happy to have you here, Doctor.
Thank you, Deputy Mayor. And I really, truly want to thank the mayor. I remember these conversations when he was the borough president in Brooklyn. So I'd also say that as a safety net system serving residents of central Brooklyn, free of anything is a good thing, but particularly free training in lifestyle medicine and nutrition so that we can integrate evidence-based approaches in how we conduct our clinical practices. But also in our training, we have several hundred residents. We are also an academic medical center. 200 internal medicine residents, many surgical residents, psychiatric residents, and all of those disciplines need to integrate this approach in how they deliver care. There's lots of discussion about diabetes, about hypertension, about other chronic conditions, but frankly, all chronic conditions can be ameliorated with this approach. I also know that if you provide this approach to one person in a family, the entire family can live their best lives possible. We know this. We know that we must change the trajectory, particularly in Brooklyn, where in certain neighborhoods in Brooklyn, people live more than a decade less than others who live in more affluent neighborhoods in Brooklyn and in other parts of the city. And most of that is caused by chronic conditions. I am so pained when I drive up Atlantic Avenue and I see young people who are amputees in wheelchairs. When I see people whose vision is impaired because they haven't gotten the kind of care that they need, because they haven't been provided the alternatives that are being talked about today. So I am extremely enthusiastic about this free training. We will get hundreds of our staff, not just our doctors, our nurses, our nutritionists, our social workers, our psychiatric staff to engage in this free training and to employ this approach in their clinical practices. So thank you very much for giving me the opportunity to speak to this. It is so amazing that the City of New York is embarking on an effort to ensure that every New Yorker can live their best lives possible. Thank you.
Yes, he said, well said. This is why I'm a fan. I think you put a finer point on what it means for every New Yorker, but particularly Black and brown communities across the city, and the health disparities so many communities face and how we think that this will help us create a healthier city. Before we close, I'd like to highlight that in your press release, you'll find support for this initiative from national healthcare leaders, including Dr. Richard Carmona, the 17th Surgeon General of the United States, and 2 former U.S. Health and Human Services secretaries spanning the Bush and Obama administrations, among others, showing that from a healthcare, from a fiscal perspective, and yes, from an equity perspective, as I said, this is a big deal. Lifestyle medicine is our pathway to a healthier New York City and a healthier America. Now I'll turn it back to the mayor for topic. Questions?
Yep. And I cannot overemphasize what you stated, Deputy Mayor. Many people outside the medical profession probably don't understand the magnitude, but this is a big deal. To have our medical professions use science-based evidence to incorporate lifestyle changes, the role that food plays on chronic diseases, and to have the powerhouse of medical institutions with us as we roll this out. Was started as a spark many years ago with Dr. McMacken and one lifestyle medicine clinic at Bellevue Hospital. Now it's in every H&H, and now we have the partners of our top medical institutions that are starting the process, what our medical schools have not started to do, but to look at food is thy medicine. Let food be thy medicine. And this has been during the days, I just came back from Greece. This is in the days of Greek medicine, let food be thy medicine. And we're finally catching up to what they knew. So we open up to some on-topic before we do some off-topics with Bernadette.
Good morning. Just wondering if I could hear a little bit more about what this training will look like practically for doctors. How long will it be? And then ultimately, how do you expect them to implement lifestyle medicine? Is it when they're prescribing medication, also prescribing diet? What does it practically look like, and what will be different for patients?
Yeah, and before the question, I'll never forget my endocrinologist. When I went in to see her, and she basically told me that, listen, Eric, don't listen to all that about you could reverse your diabetes. Not possible. This is your reality. And I gave her a book from Dr. Greger, and I remember her texting me at 1 a.m. in the morning when she just read the book and stated, I never knew this. I went through medical school. All of this information in this book, How Not to Die, is Dr. Greger's book. And she was just so blown away. And then as I started to go back to her over and over again, and she looked at my numbers decrease, she just got her whole family involved, and it became a family conversation. And so the goal here is to have our medical professionals start to first become aware, because many don't know, and then incorporate it into their practice. But you could tell us how the program is.
Sure. Yeah, so our program, it starts with one CME that's in just the introduction to lifestyle medicine, sort of contextualizes what is lifestyle medicine, what are we talking about, why is it important, where might there be cost savings, where might there be improved health outcomes. And then that's followed by courses in food as medicine, one very focused on prevention, food as medicine for prevention, and another food as medicine for chronic disease treatment and remission. And so, as Mayor Adams said, this is a taste of lifestyle medicine, right? We're giving people an introduction so that you can open their eyes. There's lots of opportunities for further training. But we find that just opening the window to this gives physicians the hope that they can begin to interface with patients in the way that sometimes many of them went into medicine to do, to heal, not just refill prescriptions. And so it fits into any number of models. It can fit into physicians being becoming more and more aware of what those community resources are. It can lead to physicians more and more often making medical nutrition therapy referrals. It can lead to physicians building programs within their health systems that integrate all the interdisciplinary team to really develop something that's very robust. So it's going to be different for every practitioner, but the first step is this, which is to open the door, open awareness, and to begin that building process.
Is the training optional or required? And a second question being, is it shocking to you or surprising to you that so many healthcare professionals don't talk about healthy diet already, and that it justifies a $44 million investment to make that what many people consider sort of a basic observation knowledgeable to these folks?
Well, the fact that it's shocking is really not shocking anymore to me. We've seen the lack of education across medical school curriculum, and just talking about the importance of nutrition is not really helping and supporting patients to do that. And so a lot of what lifestyle medicine does is gives physicians and other healthcare providers the tools to really help patients, to support patients, not only to tell them to eat a healthier diet, but what does that really mean? And I don't think it will be mandatory. No, I'll let you speak to that.
And like attorneys, doctors do continuing education, and they get points for that. And we want to incorporate that into the system that's already in place. But just to answer your question, I'll never forget Mom, who I lost last year. Mom had heart disease, diabetes, high blood pressure, arthritis. She had the whole American package. And she was on insulin she was diabetic for 15 years, 7 years on insulin. And when she went to her doctors and said, my son was able to put his diabetes in remission, I want to try this. Her doctor said, if you try it, I'm going to drop you as a patient. And I was able to put Mom in contact with Dr. Dunaev, who's a lifestyle medicine doctor. And within 2 months, Mom was off her insulin. And she was on a real pathway to deal with the betrayal of a poor food system and poor medicine. That she was on her way to recovering, but it was hard. Food is addictive, and when you use it as that Southern diet for 80 years, the Caribbean diet, the Italian diet, our food is how we greet ourselves. But we are showing how to get the same taste you want, same cultural norms, but at the same time having a healthy meal. But we got to get our doctors on board. Those white coats are more than outfits you wear today. There's a level of trust that goes with what your doctor tells you. And if your doctor tells you it's not possible, you're not going to believe it's possible. And that's what we want to do. We want to empower our doctors. I personally believe doctors have been betrayed in medical schools, that they have not been introduced to the power of food. You do an analysis of the courses, you probably see one course, and 24% of the medical schools in this country would give one course on nutrition. We focus on prescription. The real prescription to reverse these diseases is not a blue pill, it's green broccoli. That's what we need to focus on.
Julia? So Mr. Mayor, how does this translate to the patient? Is every doctor, let's say in health and hospitals, required now to have a conversation with a patient? You know, stay away from the soda, stay away from the cookie. How will that work?
Now, and I make my own cookies. See, that's the big thing that we must do, because food must be good for you, it must look good to you, and it must taste good. And if anyone goes in and think that you could change a person's lifestyle by not addressing the palate and the desire to enjoy good foods, it's a big mistake. And so this is the first step, opening the door. And then we want to continue to explore having dietitians make good, healthy meals. When people leave the hospital, allow them to be in our cooking programs and some of our food pantries, you know, how to cook good tasting, healthy meals. Once we educate the doctors, the nutritionists, the nurse, it will be part of the conversation. Because if I'm in the hospital for heart disease and all of a sudden I decided to take the plant-based meal, and I enjoy it, the doctor needs to go in there and reinforce it. This meal is actually going to help you in what you are dealing with in your heart disease. I'll never forget a quick story. When I was the borough president, a woman looked at me. I lost 33 pounds in my first 3 months. And she looked at me, she says, my poster, I was, over 20-something pounds. She said, you look different. I said, I said, yeah, I met a doctor in Ohio, and she said, Dr. Esselton. And I said, yes. She says, let me tell you the story. She says, my husband was on a hospital bed, had a heart attack. He couldn't talk, tubes were in his throat. He texted me, find Dr. Esselton. Dr. Esselton did the same thing with me and Bill Clinton. Dr. Esselton is Bill Clinton's doctor. And he told him that he could turn it around, he could reverse his condition. He went to his cardiologist. His cardiologist said it's not possible. A year later, he noticed that his system totally changed. His arteries and whatever the medical terms are just was a complete reversal. His cardiologist said to him, can you introduce me to that doctor you went to, because I have to go in for a stent, and I would rather follow what you did instead of. That doctor didn't know. So we got to educate the doctors so that they can take care of themselves and they can take care of their patients. And that's what this is going to start doing.
Any other on topics? Sorry, I said on topics.
I want to ask.
You have an on topic?
It's not about the announcement, but I do want to ask.
Well, okay.
The
Let's get to the on
folks
topics.
as well.
Did you have an on topic?
Yeah.
Yeah, go ahead. Just we'll come back to you.
You know Kate.
The other aspect to this is food access. I know you've talked a lot about this and made some announcements regarding this. Can you provide an update about any initiatives you've started? I know you have talked about, I think, coursing or trying to get more groceries into underserved neighborhoods. Can you provide an update on progress on that front, or anything else the administration has worked on so far there?
It has to be, the whole ecosystem must change. But we have to also, while we're changing the ecosystem, we have to show people what they can do with where they are now. People often told me at this journey, well, it's too expensive to eat healthy. No, a bag of lentils, you can make lentil burgers, lentil stew, you can make lentil soup. That bag of lentil only costs you $3 a bag, and it can feed a family of 4 for a couple of days. It's about showing people where you are in your grocery store. In the borough president, we walked around the grocery store and showed people what are the alternatives they can purchase. So while we put healthy food, food pantries, serving healthy food, while we're doing this, and get into where we ought to be, we have to meet people where we are. The goal is, while we're putting programs like this, is also to make sure that when people get out of the hospital, that they go into locations where they could have access to healthy food. And that is part of our major initiative. Kate, who's here, who's leading that charge. We are attacking this problem on all fronts, showing people how to cook healthy meals, showing people have access to healthy food within their own grocery stores, pushing for more healthy food. NYCHA was not allowed to have food pantries. Farmers markets on their grounds. That is ridiculous. With all of these health crises, they can't have food markets, farmers markets on their grounds. So we're looking at all the problems that are preventing people from having access to healthy food so they can live healthy lifestyles. And as you stated, one of our concerns is to make sure we get more supermarkets, put that part of our plan for developing. We want to encourage those who are building housing, also build supermarkets and access to it. Okay.
On topic, we'll just go to Ayana real quick and then we'll transition.
Sure, sorry, I have one more on-topic question.
Yes.
For the doctors, if there's a New Yorker who's interested in a lifestyle medicine approach, is there a way that you can seek out a medical professional that takes this approach if your primary care doctor doesn't necessarily take that approach? And then also, how do New Yorkers decipher if there's an aspect of lifestyle medicine that they should trust? I mean, there are folks on Instagram or health food stores that may say, hey, drink this tea or this green juice will help lower your cholesterol. So how do you navigate this as a New Yorker if your doctor doesn't necessarily practice lifestyle medicine or hasn't been trained, but you want that to access that for yourself?
Dr. Mitch Katz, the president of Health and Hospitals. So at all of the public hospitals, people will find lifestyle medicine practices that are run by great doctors that Dr. McMacken has trained herself. And it's not just about the doctor, it's a whole set of programs that teach people about relaxation, about meditation, exercise, avoiding substances that might disturb them, and really focused on, and the doctor was talking about tools. So we don't want to lecture people. Lectures are not helpful. You don't sit across from a patient and start lecturing them. What you talk to them about is, what are your goals? What is it you'd like to see? So the mayor set a very clear goal. I don't want to spend the rest of my life taking medicines. That was his goal, and then he achieved that goal. We've had patients who set other goals. I want to be able to travel. I want to be able to walk without a walker. And whatever that goal is, that's what we focus on in those practices.
And but that's a good question that you're asking. We're going to figure out, and we should sit down, Dr. Katz and Dr. Fassan, and come up with a list of doctors who are lifestyle medicine doctors, so that people can know where to go and figure out how to put this on one of our sites, if it's on H&H sites, if it's on our site. But I think that's a good question, because the average person don't know where to go. And you don't want them walking into, someone that is just going to tell them to do things that's unhealthy, because you have to do it correctly. But we're going to circle back with you. I think that's a great question, and we will create a way that is medically sound of telling people, here's a list of people who practice plant-based or lifestyle medicine. We're going to talk about that. All right. Thank you all. Y'all should hang over to the side, because I'm going to need a doctor by the time I finish with these folks. Thank you. Thank you all. How are you? Good.
Hi, Mr. Mayor.
How are you?
So I wanted to ask this with the private hospital folks behind you, but I'm wondering, how are the private hospitals going to be sharing the burden with H&H of the new announcement to involuntarily commit mentally ill or those suspecting mental illness into the hospitals? And will more beds be made available as well? And are these people going to be, or these hospitals going to be embracing the training under state guidance and also retraining their staff? But how is that going to be shared?
And and actually had a brief conversation with Ken Rasky and part of that conversation. We're going to have some follow-up conversations because we need private and public together to address this important initiative that we are embarking upon. But, you know, I've been looking at some of the coverage, you know, particularly the front page that I saw the other day that said flawed. Let me tell you what's flawed. Flawed is a city that walks past people who you know cannot take care of their basic needs and they are endangered to themselves. I didn't become mayor to climb a hill. I became mayor to climb a mountain. This is a mountain that I'm climbing. You all know it. You cover these stories. I don't know why you're acting like you don't know it. There are too many people on our streets that are not capable of taking care of their basic needs, and they are endangered to themselves. That is the category. I don't know why we write these stories that everyone who talks to themselves is going to be taken to a hospital. That is just not true. Everyone who's living because they're homeless is going to be taken to the hospital. That is not true. We have a very specific category that we are looking to see if they are going to go to a hospital, and the determination is going to be made if they need additional care, and that is what we are accomplishing. And we need the partners from H&H and our privates, and we're having continuous conversations with that. We need help from the state. We need help from the federal government. We need to rethink this. And we know that it's not an easy task, but I didn't get elected to do easy tasks. I got elected to look at these systemic problems that have been in this city for generations, that all of you write about. All of you write about this, on what's happening in this city. And I'm going to face them. And you can't face them with fear. You have to face them with focus. And I'm focused. Hold on. You see what I have here?
Yeah, you see what happened? I thought I was dismissed. But anyway, good afternoon to everybody. Mr. Mayor, I'm Ken Rasky, president of the Greater New York Hospital Association, and I think the question dealt with the mental health initiative, which we support at the Greater New York Hospital Association, and how the voluntary private institutions will react to that. Look, we are going to work steadfastly with this administration to make this a reality. And we have hurdles. Of course, there are hurdles. There's hurdles in everything. And those hurdles could be, you know, reimbursement issues, expansion of capacity, what have you. Right now, I told the mayor that this morning that we are very, very, very much committed to his initiative. And by George, we're going to make it work. So, Mr. Mayor, that is a commitment on behalf of the Greater New York Hospital Association to you and this administration, but more importantly, to the people of New York.
Thank you.
Quickly, Ken, will you be dedicating a certain amount of new beds in the hospitals?
Miss, I'm sorry, I couldn't quite understand you.
Will you be dedicating a certain number of beds to assist this initiative in
No, you can't do that. I mean, because psychiatric problems are like episodic issues, so you can't just allocate beds. What we did, and Mitch made a comment about this recently in the New York Times article, is that many of the hospitals decanted the psych beds to be used in the pandemic. That's a fact, to take care of the COVID patients. And now they're restoring them, putting them back online. So, you know, the expansion is occurring through a natural process. But will we have to wrestle with other hurdles? The answer is absolutely yes, we will. But we will clear those hurdles. Okay?
Thank you. Thank you, Ken.
Thank you, sir.
Good to see you.
Could you address the dramatic rise in anti-Semitic hate crimes this month?
Listen, I think it's a combination, and that is why I was in Greece, you know, and despite people were saying, why are you going to Greece? Because there's an anti-Semitism problem globally. And mayors from across the globe, we all met there to engage us in this conversation. And listen, we have normalized hate. And I continue to say one of the biggest spreader of this hate is social media. What social media is doing to normalize hate, to give a platform for hate, to spread hate, is just really alarming. And you know that New York City has the largest Jewish population outside of Israel. So if one has a desire to be harmful to a particular group of people, New York is the place you're going to come because of the diversity of this city. But we're going to continue to partner with organizations like JCRC and others to really infuse education into our schools through our Breaking Bread, Building Bond initiative to get people in at the table. We can't only police our way out of this, but I also think prosecutors must send a strong message of no plea bargaining. If you are found guilty of a hate crime, you should be held fully accountable for that crime. I don't think anything is more horrific to a person to be attacked because of their gender, their lifestyle, their religion, their ethnicity. That is something that we should hold dear, and we're going to continue to do our job. We're going to classify the crimes. We're not going to try to sugarcoat them. If it's a hate crime, we're going to call it a hate crime. We're going to pinpoint those problems and really lean on our partnerships that we've had historically in this city.
Mayor, so a couple of things with the mental health initiative.
Yes.
One, last week you said that training was starting. Just wondering when that initiative is actually going to be rolled out, when they're going to start moving and transferring mentally ill patients to hospitals, and what sort of accountability system is going to be in place? Who will they be reporting to? First responders? Will they have to report each night? How many people have to go into one of these hospitals? And what will happen if someone is transferred and they didn't need to be transferred? Will there be some sort of accountability there as well?
So let's peel back each one of the questions. First, the training started the day that I announced it. That was the first level of training. But let's not ignore the fact we were already out there taking those who needed help. That didn't start. The police department, mental health professionals, this has been really led by what Deputy Mayor William Isom has always stated, that we're going to lead with the mental health professionals. This is what Dr. Fassan, that came here from Fountain House, he knew the best way to engage people on the ground. And so we were already doing this. This didn't, the actions of dealing with people that were in severe need of mental health assistance, we were doing already. What we found based on being on the ground, the lack of clarity. Our police officers and others, our hospital personnel, our outreach workers, there was this sense of lack of clarity. And so what I did is state, let me give everyone clarity of what the mission is from the city. Now, if we transport someone to the hospital and they don't need additional care, we're going to put them on a pathway to our shelters. We're going to put them on a pathway of support services that are there. We need to be engaging in those who need help. And the only way we could do that is to do a real diagnosis of their needs and give them the support that they need, and that's the follow-up that they need.
System, though, would you just want to get to everyone? But I'll come back. There was one part of my question Sally, go ahead. I'm fine. You're fine. Melissa?
No, I have a question. I just meant if they were, I didn't want to. Okay.
I just like this. There's a second part of the question.
What did you say, reporting system? What do you mean?
Yeah, just is there going to be a reporting system? Just how many people are transferred each night? Is that going to go to a certain
within the limitation of revealing, within HIPAA laws or other laws that we're not required to report, we're going to try to be as transparent as possible so that you can gauge the program, but we're going to always abide by the laws that ensure the privacies of people who are seeking care.
Mayor, today a Democratic City Councilman, Ari Kagan, is going to announce that he's switching to the Republican Party, and part of the reason is the redistricting process that your administration took part in has made it kind of harder for him to win as a Democrat in the district he would now be in. So I'm wondering, as one of the leading Democrats in New York, what is your message to this councilman and other Democrats who find themselves in difficult districts? Which parties? Do you want him to stay as a Democrat?
Well, I would hope that he would stay as a Democrat, and that was an independent commission where several bodies of government participated in the appointment of personnel to be on that commission. And so it wasn't something that we controlled. And I don't recall many redistrictings where everyone was happy. I don't recall it. I remember I was drawn out of my district. That's what independent is. If you come away with everyone being unhappy, you did the right thing. And so I would hope he would stay a Democrat, but he has to make the decision on what he thinks is best. You know, I am not a city council person. I don't control how the lines are drawn. And so he's going to make a decision on what's best for him politically.
I do have two.
All right, well, ask one and we'll come back.
Okay, thank you. Mr. Mayor, since you're talking about food and about health, I want to come back to a question. I've asked you about this before, but we're continuing to hear complaints from the migrants who are living in the emergency homeless hotels, specifically about access to enough food. So
Access to food?
Yeah, because so your Department of Homeless Services insists that all the meals are good and that there's no problem and they're getting enough food. So, you know, that's what they're telling me. But the families widespread are saying the portions are too small. There's also the challenge that they don't get food stamps, they can't work, they can't supplement the food. The meals are not age appropriate for toddlers, and they don't have refrigerators or microwaves, so they really have no ability to cook, you know, the things that their children eat, and some of that is a cultural thing, they come from another place. But I just wonder, is this an issue that is on your radar, and what do you want to see happen? Because it's been a long-standing complaint that we've been reporting.
Yeah, you know, life is idealistic and it's also realistic. When you have over, you know, what 20-something thousand migrants that have arrived at our city with different cultural food norms, palate and changes, you must reach what is the obligation. We have exceeded our obligation and gone beyond that, from eyeglasses to making sure everyone gets the meals they deserve, to incorporating them into school, to make sure they have a place to sleep. We have been a model for this entire country. And I know that there's no one in this city, migrant or non-migrant, that needs some place to eat, don't have a place to eat. Every person that is here from the asylum seekers and the migrants, they're getting 3 meals a day. They're getting 3 meals a day. I know that. And now, if there's a location that they're not receiving that, please let me know. And I'm going to do a spot check and make sure that's not happening. But everyone is getting 3 meals a day. Is it something they probably was used to eating in Caracas or Margarita Island? Maybe not. But we're going to make sure they get a balanced nutritional meal for their family. And then as we continue to move and they are able to be employed, it makes no sense that they're here for 6 months and they can't get a job. As they're able to get employed, they're going to incorporate into this beautiful city and this beautiful country. This is the starting place, and they're going to grow from that to have this American experience.
We have time for one more. Juliet?
Yeah, hi, Mr. Mayor.
How are you, Juliet?
I'm okay, how are you?
When I say your name, I smile. When I say Bernadette?
Getting back to the mentally ill who can't take care of themselves. Yesterday, Deputy Mayor Williams Isom said to Marcia Kramer that there were 50 beds going to be set aside, and they're going to expand that to 100. Is that the case, and is that enough?
No, we are going to always need more beds, and we're going to adjust. And here's what I'm learning. Because we decided to be front and center on this problem, we're now creating creative energy. And people all over the profession that have been in this place are now reaching out to us and saying, here's another idea, here's another idea. We're going to be exploring with Dr. Fassan some of these great ideas we're getting. And so the starting point was for us to say, we're not accepting this anymore. And now we're getting professionals all over the country who are reaching out to us and say, we want to help. And we believe there are some real solutions to deal with the bed issues. There's some real solutions to deal with the hospitals. And we're going to start implementing and rolling those out. We know this is a Herculean task. We know that. We know there's a challenge. We're well aware of that. But the team made a real decision. We're going to face this head on.
The amounts of beds that you're starting with?
It's the beginning. It's the beginning of the process. And as we need more, the same way we did with the asylum seekers, remember, we had to grow into, as we needed more, we responded. This is the hallmark of this administration. We respond and meet the challenges. We don't vacillate. We don't come up with excuses. We respond and meet the challenges.
much does your guitar trip cost? How much does it cost? Because I was Googling.
What?
You're the guitar trip.
On your dime, right?
My dime.
How many dimes?
Yeah.